I'm joined by Dr. Peter Yu. He is a physician-in-chief at Hartford HealthCare Cancer Institute. Thank you so much for being with us, Doctor.
You're very welcome, Kara.
I want to talk about this new study that is showing that more cancer patients are actually dying from COVID-19, but not as a result of cancer treatments as we might think. Can you tell us more about this?
Yeah, certainly. This weekend was the world's largest meeting of cancer physicians, and there was a special session held to talk about two studies that were just released. The first was a study from the United States, Canada, and Spain, looking at 1,000 patients with a diagnosis of cancer who happened to get a COVID-19 infection. The second study came from Europe, 400 patients, all of whom had lung cancer, and then got COVID infection. And the question was, what happens to patients? Are they any different if you have a cancer diagnosis? And the answer was yes, in several important ways. The first way that was very striking was a doubling of the risk of dying if you had COVID-19 on top of a cancer diagnosis. So in the United States study of 1,000 patients, the risk of dying was 13%, which is just double what the Johns Hopkins database is showing. The European studies showed the same finding as well. So clearly, if you have a cancer diagnosis, you really want to maintain social distancing and avoid the possibility of being infected.
So that's really the takeaway, that even though things are starting to open back up, what is your word of advice for people who are battling cancer right now?
So that's the first point. The second point was that cancer can still be treated even in the setting of a COVID-19 infection or a COVID-19 pandemic. So we looked at our patients who had surgery, some form of cancer surgery in the 30 days or month before they were diagnosed with COVID-19 to see if having surgery increased the risk of dying from COVID-19. The reassuring answer was no, it did not. So patients who had surgery in the last month before the diagnosis did not have a higher risk of dying. Patients who received chemotherapy also did not have a higher risk of dying, but the answer there is a bit more subtle. It depends on what kind of chemotherapy we're talking about. Chemotherapy is a very broad term.
Right.
So if you look at hormone treatments or precision medicine treatments, which are often called chemotherapy, the risk is not that, there is not a high risk of dying with COVID-19.
So Doctor,
if you look at more traditional...
I apologize, yes? We're going to run out of time. So I just want to wrap it up in that the main thing that you want to get across to your patients out there is that you do want them to get treatment, but they also need to be very careful out in the world because a COVID diagnosis and a cancer diagnosis at once is more dangerous.
And they need to be tested. And so we have a policy of testing every patient just before surgery or starting radiation or chemotherapy to make sure they're not infected. And if they are, we will talk about delaying the treatments.
Thank you, Doctor. We appreciate your time and with sharing this new information.
You're very welcome, Kara.